An effective healthcare system guarantees access to improved treatment, decreased morbidity, and mortality. In Nigeria, primary healthcare has been poor due to the failure of successive governments and relevant agencies to address the underlying challenges with strategic plans. While many African countries have improved healthcare services to fit their population need, access to primary healthcare by the poor in Nigeria is highly limited, leading to increased death rate arising from preventable causes. There is therefore an urgent need to adopt a well-established healthcare framework that will be responsible to local and emerging health challenges, especially in the rural areas. Welcome to Break It Down. Hello and welcome to Break It Down, where we make matters of governance, policies, projects and development easily understood by all. On this show, we simply simplify the issues. Today with me, I have a very distinguished Nigerian, an eminent personality, a superb woman, an extraordinary human being. With me, I have Professor Idia Izeyamu. You're welcome to the show. Professor Izeyamu is the consultant orthodontist, University of Benin Teaching Hospital. She is a professor of orthodontics, University of Benin, and she is a Commonwealth Fellow, craniofacial orthodontics. I mean, it's also tongue twisting, but we'll get to know what exactly this area of specialty in medicine means once we start with her. You're welcome on the show.
Thank you.
So what exactly, before we go into what we have today, we are talking about primary healthcare in Nigeria, the failure of primary healthcare in Nigeria, and the far-reaching implications. Well, let's first go to orthodontics. What exactly is orthodontics?
Orthodontics is actually a specialty of dentistry, whereby we rearrange teeth that are not properly arranged. We look at patients who have some anomalies, some things that make their smile not to be okay, and we try to work on the smile, and we try to arrange the teeth and make the patient have a perfect smile, if there's anything like that.
How is it different from, for example, maxillofacial?
No. Maxillofacial are the surgeons.
Okay.
They are the ones that go to theater. They work on accident victims who have fractures, who have deformities. They are the ones that do surgery. But the orthodontists, we rearrange teeth that are not perfect and teeth that are poorly aligned.
So we're talking primary healthcare, the failure of primary healthcare in Nigeria, and the far-reaching implications. First, we're on Break It Down, so we'd like to break down what primary healthcare is. What exactly is primary healthcare?
Okay, thank you. Primary healthcare, as it's simply put, is healthcare at the grassroots level. That's why it's called primary. So when we're talking about primary healthcare, we're talking about healthcare at the primary level, which is the grassroots, or the very, very basic level. It's actually healthcare for the poor. Healthcare in communities that are small, you group them into small communities so they can have access to basic and affordable healthcare.
So in your own view, what is the state of primary healthcare in Nigeria today?
Primary healthcare in Nigeria, I can not really talk about the Nigerian experience because I would need the data for that. But for those states, the primary healthcare system is in shambles. Ideally, we're supposed to have a healthcare center in each ward so that the people that reside in those areas can have access to affordable healthcare. It doesn't have to be anything complicated. Simple illnesses that will not require transportation to the secondary or the tertiary healthcare centers. Simple sicknesses like malaria, cuts, bruises, those basic things that a general doctor or a dental practitioner can take care of at the grassroots level. So those people who live on the grassroots level, those who you call the poorest of the poor, those ones are having serious challenges in accessing healthcare at the grassroots level. I'll give you an example. We went to a community and the primary healthcare center was badly broken down. There was no roof and it had not been opened in decades because the door was covered with cobwebs. And we asked the people in the community, when you are sick, where do you go? And the lady said that we're talking to said, oh, we go into the bush, we pluck any leaf and we eat. If we survive,
so they have resorted
survive.
to nature.
They've resorted to nature because some of them, they've just left themselves to God. So the primary healthcare system is not working because there has been no drive to make it
I
work.
just wonder at what point did we get it wrong? Because when I was growing up in Ubiaja, that was where I grew up, we didn't have a hospital. We had what they called a dispensary, which was like for what you said, first aid, burns and all of that, wounds and all of that. If we had any other bigger ailment, we went to the hospital in Uromi, which was far and in between. What do you think, when did this start going wrong? Was it when the military came in? Could it be the military? Or could it be successive governments over the
I
years?
think it has been neglected by successive governments over the years, and it stems from not understanding the problems at the grassroots. If you go to the grassroots, you will see that the challenges are real. People are poor. That is where you see the poorest of the poor. Many of them have lost hope. So for them, they just take sickness in its stride. If these primary healthcare centers, a proper plan had been fully implemented, we will not be where we are today. Because we have many of our doctors leaving Nigeria to other countries because of lack of jobs.
I guess we'll come back to doctors living Nigeria, doctors' welfare.
It's not
welfare of practitioners.
It's jobs.
Okay.
Somebody may have a job, but the welfare package may not be adequate for that person. But when a doctor has no job, after graduating from medical or dental school, there's no job, you tend to want to look for where you can find work so that your skill does not die. So if the primary healthcare systems were functional, they will mop up a lot of the young doctors into the system to be able to do basic medical and dental practice. Primary healthcare does not require specialty. It just requires somebody who is a doctor, who is a dentist, and who can do basic procedures. If the procedures get more complicated, then the patient is referred to the secondary healthcare level, which are the general hospitals, the specialist hospitals. And then from there, if it is more complicated from those hospitals, then we move to the tertiary healthcare hospitals. So the primary healthcare centers have been neglected. There have been no plans for staffing, no plans for, where you have to maintain the equipment that is there for renovation, for overhauling, for rebuilding, no plan at all. So what we have is that the ones that were built in the 1980s, the 70s are the ones that still exist. Apart from a few, very few new ones, and those new ones you find out were built in communities where one person had an interest and decided to do it by themselves. But in terms of the government doing something about it, it's not been happening.
You just gave me an information now that is kind of conflicts with what we have outside. Outside is like we don't have enough doctors, but you are telling me now that the doctors don't have enough jobs.
There are no jobs. That's why the doctors are leaving, and that is why we don't have enough doctors. You see, we graduate enough doctors to take care of our people. We graduate enough doctors every year. When a doctor graduates, where does he work? What does he do? There are no jobs. So he looks for where he can find a job. He goes to a greener pasture. Those that have jobs There are no infrastructure. You are frustrated working in a hospital where there's no equipment. So they leave. They want to go and work where they will be fulfilled. But you find that majority of them that come out of school, there are no jobs. If the doctors were mopped up into the primary healthcare system, for example, we have youth corpers that are doctors, when they graduate and they are doing the mandatory 1-year NYSC service, if they are posted to primary healthcare centers, they will gladly stay there. But those primary healthcare centers are non-existent. If you look at most of the federal government parastatals, there's an embargo on employment. So the doctors that want to work, they find it difficult to get jobs. So they look elsewhere.
Wow, this is really sad. It's not good news at all for anybody. Not good news for the country. Not good news for my state, Edo State. By the way, we are recording Break It Down this week from Edo State. This is my state. I grew up here. I have passion for Edo State. Benin is my city. We'll be back. We're still talking primary healthcare, the failure in Nigeria, and the far-reaching implications. And we're still with Professor Idia Iyamu. We'll be back. You're still on Break It Down, where we make matters of governance, policies, projects and development easily understood by all. We're still talking primary healthcare, the failure of primary healthcare in Nigeria, and I am still with the distinguished Professor Idia Iyamu. So we're talking primary healthcare, which I know is an area for you, an area of passion. You're very passionate about it because I've watched your clips and I saw you talking. In fact, you were pouring out your heart about the failure of primary healthcare. Why is this a passion for you?
Well, it bleeds my heart because poverty is very high. Maternal mortality rate is high. The poverty index is high. People are suffering. Every day, people come to you crying because they don't have access to healthcare. It's not affordable. And they've lost hope. And you start asking yourself, why do people have to travel from the village to come to your house because they cannot go to the nearest healthcare center? And they tell you there is none. You say, okay, and you are coming down to the big city for these minor ailments, and they will tell you because they had nowhere else to go. Small sicknesses that ordinarily you should just go down the road to the nearest primary healthcare center and get some form of relief, it has become a challenge. Sicknesses that should have been curtailed early are being left. They become complicated, and before you know it, the person has developed more major issues, which they say prevention is better than cure. If they had gone to a primary healthcare center and dealt with it, and then they will not be where they are today. We are talking of the poorest of the poor. We're not talking of those of us that live in the big cities. We went to a community and we saw a very beautiful primary healthcare center. Very beautiful, but it was empty. Beautiful structure. A structure does not make the matter. It's the content of what is in it. Very, very beautiful structure. It even had a solar panel on the roof, but the gates were locked, the windows were shut, the doors were locked. And it was so beautiful when you look at it and compare it to the next door house, which was a mud hut, then you know that it is no more accessible. We're talking about healthcare that should be accessible, it should be affordable. And something came into my mind. I said, if we build a primary healthcare center just to showcase for the cameras, we take the cameras there, we do a big show, we cut the tape, and after everybody leaves, we lock it up. The people in the village are worse off. So it has failed as far as I'm concerned, because there must be a plan. What is the plan for the poorest of the poor to be able to access healthcare in their communities. When we talk about the plan, we're talking about the plan for the infrastructure. Infrastructure that is viable, that will work, that is accessible, that the people can go in there confidently. They are not threatened by what they see. What about the manpower? Is there manpower there? Is there plan for manpower? There is none. And the local governments whose statutory responsibility it is to take care of the primary health care are not doing anything, because they should have a doctor in each local government. And that doctor should be able to go to the various primary health care centers in their LGAs. But it's not working. There are no nurses, there are no healthcare workers, and the worst part is there are no plans. Even Panadol is not there. Many of them are locked up. The few that are opened, it's only God that will help us at the state of things. Because there's no maintenance, there's no follow-up. How can we help people that go to the farm and maybe have an injury from maybe their farm tools or something? At least they should be able to go from their farm to the primary healthcare center. They should be able to have that wound dressed. They should be able to have tetanus toxoid given, and they are managed. They don't need to travel. But when these things happen, they cut leaves, mix it with whatever concoction they see, put it on the wound, it deteriorates, and a simple wound becomes a major problem, and we're talking of maybe loss of a limb. They can work. If we have those that are passionate, people who believe that the poorest of the poor, if nothing else, they should be able to access healthcare. If nothing else.
Do you think what could be responsible for this is that the local governments for a very long time did not have any autonomy?
Well, it's possible, and again, you need somebody that could be a driver.
Okay.
You know, if you have somebody who is passionate and is driving it, then it will be a priority. If your priority is that your people must have health, then it will be a priority. You say women should not die during childbirth because there is nothing to transport them from the primary healthcare centers to the secondary healthcare centers. There are no ambulances. It must be a synergy between the state and the local government. And there has to be somebody who is passionate to drive it. You say, look, there must be something that will work. That when there is a crisis in this local government, then we should be able to move them from the primary healthcare center to the secondary healthcare center. There must be some ambulances that are there to transport them. Government needs to have a driver, somebody who is passionate, who says, look, our people may be poor, but they must be able to access health care. They must be able to get the best. We have NYSC doctors that come. They can be posted to the various local governments, to primary healthcare centers. But the problem is, there is no accommodation for them. There is no security for them. There is no safety. So it's difficult for our youth corps members to be put in villages where you are not sure of their safety. So it's a real problem because it's safety first. If your doctors are safe, the NYSC doctors will bridge the gap. They will be able to see those patients for basic healthcare problems. And again, you have to be able to go around the various communities and let them know that there is a functional healthcare center in their community. And this you can do through local town criers that will go around the communities and ring the bell, hit the agogo, and tell people and say, look, oh, we get one small hospital here, oh, come oh, doctor there, oh, nurse there, oh, come oh. Then you have broken that barrier. So when you do that town crier through the various villages, the awareness is built up that, look, we now have a primary healthcare system here. And once we have this primary healthcare system, it is free, oh, make una come, oh, government don't pay put, oh, you no go pay for this, you no go pay for that. And the villagers will go there. Now when they get there, if their problem is bigger than the primary healthcare center, the doctor in that primary healthcare center should be able to call for an ambulance to take that person to the secondary healthcare center. But it's not there.
Okay.
And then even, sorry I have to pause because it's really, it pleases my heart.
Okay.
And then there are some communities that are far away from a primary healthcare center. It may be in their community, but when you go to the villages, some houses are further away, and it is difficult for them to access those primary healthcare centers. Why can't government do something to bring some form of mobility within the villages? For example, we have Keke Napep. You can modify it to be like a little ambulance within the village. It's cheap. It can go through very tiny village roads and to go to communities where you have a sick person and bring them out from there to the primary healthcare center. The doctor assesses, sees that this case, I can deal with this, or this case is more complicated. The doctor calls from ambulance from the local government sends an ambulance, picks the sick patient and takes that patient to the secondary healthcare center. All lives are precious, whether you are poor or you are rich. And if we don't have compassion for human lives, then we have failed God.
You've given a lot of solutions, you have proffered a lot of solutions to the problems on the grassroots level. How can this be achieved? How easily achievable are they?
It just takes, remember I keep on telling you, it takes a driver. Somebody who is passionate about it. No man should die because of a small problem that can be solved. No person should die. Each life matters. Whether you are poor or you are rich. People don't go to hospitals again because there are no doctors. The doctors that are looking for jobs can't find jobs. The healthcare centers that are there are run down and locked up. So where are you going to put the doctors when there are no facilities? And the doctors are looking for facilities to work in. So they migrate. Many people do not want to travel. The medical professionals, they don't want to travel. But they are forced to travel. And when they travel and they see the state of the healthcare system there, and it is light years ahead, they don't want to come back.
Yeah, who would?
No, they don't want to come back.
Thank you very much. I wish we could go on and on. Usually when I do my interviews, I like to interject. But now,
Sorry.
no, I like it because I was being educated. I was learning. And actually on this show, we want people to learn. I want them to learn in the language that they will understand, the common language, which you have given us a whole dose of it. Thank you very much for being on this show, Professor. Well, it's been an honor speaking with you.
Thank you.
So that's been it on Break It Down this week. We've been in the ancient city of Benin City, my hometown. I'm proud to say this is my hometown. Well, we'll be here same time next week. We'll see you. Make sure you stay tuned. I am Moji Danisa.